Hello, I'm John Mobobia at 254. This is my YouTube channel. Subscribe, share, and click that notification bell. I'm here to share hope for guys suffering from a long-term condition, health conditions. You can have a long-term condition which is cancer. You can have diabetes, kidney, and also heart, and also epilepsy. I suffer from a health condition, an epilepsy, long-term condition for almost 2-3 decades. One thing that I've come to note is that the only thing that can keep you going is hope. My friends, there's nothing else that can keep you going. So that at the end of the day, you're able to wake up and sleep when you're tired, when you're sad. In your heart you're feeling you're disappointed. You can say that I'm hoping in the future there's a change. In 10 minutes, in 20 minutes, something is going to change. I'll speak about the emotional part. Because that's the most hard part, the emotional part. First is to accept you're suffering from a condition. If you first accept you're suffering from a condition, then you take the right steps. You take the right treatments. You go to the doctor, you go to the psychiatrist, the dietitian. First, you have to accept you're suffering from a condition. First, you have to take the first step to go to the hospital. Some people don't go to hospital. They hate hospitals. Totally. They hate hospitals. I have somebody who hates hospitals. They hate it. They can't even go to the hospital. So when you're not able to take that step, first to accept, I have a condition, then there's trouble. First you have to take that first step. I'm suffering from epilepsy, I'm suffering from cancer, I'm suffering from diabetes, kidney failure, heart problems. First you have to accept you have a problem. Then go to the doctor. Then go and see the right doctor. Research first. You have to research first. Yeah, let's say my son has a condition. Let's say epilepsy. Go research, for example, the organization associations which deal with epilepsy as a condition. Go and look. Don't go just to any doctor or neurologist. Go to a specialist who has done or dealt with epilepsy. Knowing well it is going to cost you, so that you just can't go and see any doctor. Then you know that when you start buying drugs, they're expensive. For me, I almost spend, let's say, 5 USDs a day on drugs. The combination of drugs that I use. Then there is, because there's traveling expenses, then there's when you want to do, you want to see a doctor for a review. You have to know that you're going to spend more than 3,000 shillings. That's the cheapest doctor, 3,000. A neurologist. They go even to 15K. I saw one, I had to visit one for 8,000. It was at Upper Hill Center. 8,000 shillings. That's a long time. Now they've reached 15,000 or something like that. Even 20 for consultation fee, my friend. Only 2 hours, even 1 hour to see him. And you're going to queue. You're going to queue to see a consultant. A specialist, especially. You're going to queue for hours. Then you're going to get processes. You're going to be told to go and measure first, see your CT scan, MRI, they see your blood level, the way you can handle drugs, everything. They'll take you through the process. That is money. You have to be ready also for that. You'll know that you have to invest in your patient or on yourself. So when you make a mistake of not taking drugs or not even accepting that you have a condition, know that your investment as a patient, you're going to suffer. It's going to be a painful condition. It's going to be painful for you. You're going to be punished because you've not taken drugs. You're going to have a regression. You're going to have attacks. You're going to fall. If you fall, you will fall. If you stammer, your hands move, the guys who their hands move, if your legs, you stare, you will have them because that's punishment for not taking drugs. Not doing the right thing. Like taking coffee, you shouldn't take coffee. It's a no-no. You shouldn't even also take alcohol. You can take a wine of glass if you want to. As a mature person said, let's say a glass of wine once in a blue moon. But it's not advised. You should avoid it. Knowing that punishment, especially epileptic patients, punishment, it's a hard punishment. For not taking the right steps, you get punished. Tell me, I know it. I've suffered for him. You get punished. To take it back to control, to start going, to have the system working again properly. No, you will take time. You get punished. That's called punishment. For not getting the right medication, for not going to see the doctor at the right time. Even spend more. So my friends, anybody suffering from epilepsy as a long-term condition, know that you have to adhere to all the advice that you hear from the doctor and also research. Don't be told that, don't take drugs. Oh, there's a magician, there's a herbalist here. Oh, we pray for you, you don't take drugs. My friend, also, if, for example, there's a lady I was talking to. I usually have a TikTok channel. She said the kid had epilepsy. And then she decided not to take the kid to the hospital for a long time. What happened? The kid is suffering from other conditions, mental conditions. Now, because she did not take the matter seriously, in that the kid had to adjust as a body. You know, there's the after effect. The body is affected. The mental health, the body also is affected. When you're taking the drugs, you're also sleepy, especially epilepsy. You get tired very fast. You're sleepy, you're drowsy. Very drowsy sometimes. So you should be able to get somebody to adjust your drugs at the right level so that you don't get drowsy completely. That's why you need to see the right doctor. Go for a review. Get to know yourself. To know that when I do this, I suffer from this. At this time, I get attacks. At this time, I shouldn't do this. At this time, I shouldn't do that. You get to know the steps that you shouldn't go to. Their lights, club lights. They affect your eyesight, the blinking lights. You know that when you go there, you're going to be affected. There are those things, you know. I'm doing it. Yes, I've gone to club. I've had a drink of two. I'm going to be punished. Know that. You say, oh, I'm a human being. No, you're going to be punished. That for sure you're going to be punished. There are lights which are going to, also there are programs they tell you, these are going to affect somebody suffering from epilepsy. No, if you don't follow the right steps, punishment is there. You just get the attacks. In epilepsy, it's there. It's that you don't have to go far. You don't have to go to the hospital, you're quiet, then the doctor tells you you're not doing. No, the punishment, the stick is just, it's carrot stick. Carrot stick. When you follow the steps, the right steps, and everything is okay, you'll get one. You don't follow the right steps, my friend, punishment, you'll get an attack. If it's a bad one, you're a person who gets bad attacks long term, it's yours. It's because of your mistakes. For a parent, you're the one who's done it for the kid. Those are things that you should know. One, avoid coffee. If you can do ketonic fasting, which I'll deal later in my channel, know that ketonic fasting is good. Ketonic fasting also. They used to do it long time, for example, in the 1940s. People never used to know that ketonic fasting. That's why some people tell you, nilienda nikaomba. Ketonic fasting helps the body to heal. You don't take some foods, wheat, especially wheat. Yeah, wheat is not good. Which sometimes they say sugar, a lot of stuff. It's expensive. It's expensive. Some things we don't follow as Africans. It's expensive. The oil you're going to use, oh my friend, it's expensive affair, especially when you talk about ketonic fasting. As a parent, you should know that I'm going to invest if you decide to go for ketonic fasting. But maybe it will pay. If you're past the age of, let's say you're not a kid, sometimes there are parents who followed the steps at an early age. For example, the kids you grew with, this kid had epilepsy, but the parent took the right step, followed the right doctor's advice. They went through everything. They stopped having attacks. Now you can invest. The condition, things can change. You can even get well. Let's say you get well. Yeah. But then there are people, there are parents who don't take care about their kids. They have this, I don't know, they're just stubborn. They decide, oh, I'll give my kids drugs. Oh, no, he's doing well. I'll stop the drugs. They decide as if they are the doctors. Then there's a punishment. Oh, then they say, oh, I'm sorry. They don't even apologize to the kids. And there are people who've done the mistake. Years later, they will pay. The kid will pay for the mistakes of their fathers, the mothers, the guardians, and also yourself. Years to come by. You will pay for your mistakes. It is a hard process if you do not maintain the advice or the process of controlling epilepsy. You just pay it. Payback is just there. Hapo. I know it's expensive, the medication. Now, for example, if you don't follow the right steps, then the doctor may decide to change the drugs. Because you become resistant, you're not taking the right drugs. You're taking alcohol. The reaction in your body. Alcohol makes the reaction. For example, the medicine you're taking, it won't get, you're unable to control the problem itself. Now, imagine you're mixing drugs which make you drowsy with alcohol. Tell me, how drugged are you? You're totally drugged, my friend. Because already when you're having epilepsy, these things make you drowsy. So imagine you take alcohol, you're a drinker, total drink of alcohol. It takes you to another level. You are addicted. You destroy yourself, even destroy the body. You see a drunkard who's suffering from epilepsy. My friend, that person is gone. They're gone. They turn to be something mad. It's just another thing, another level. But when you decide to follow the right steps as a person, things are going to be okay. So in any other condition, don't decide not to take the medications. If you're suffering from diabetes, take the medication. If you're suffering from a combination of diabetes, heart problems, kidney, blood pressure, take the medications. Get to know yourself. Get to know what works for you, what does not work for you. Research, sit down. Know that one day you might wake up at night, you're not feeling well, you're sweating, you're having a recurrence, of your problem. But have hope. That's what gets me going. Hope. Hope. It makes me going. Maybe as tomorrow, maybe my condition would have gone well. Or things might change in my life. Maybe things in my life are constant. But one thing I don't get addicted to, when you get addicted to alcohol, you get depressed. That's why loving your family, staying with your family near you is good. People will love you. Love is greater than anything. It conquers everything, love. Conquers everything. They say love conquers everything. So, my friend, love your neighbor. Love your family and also love yourself. Because love conquers everything. Conquers everything. It's got patience, understanding. I thank my family also. They're very understanding. There are things that happen that a normal person cannot take. But they're understanding. Situations that happen, but they're understanding. That's why somebody suffering from a long-term condition, especially a long-term condition, needs care. You can't do it alone. You can't do it alone. You need some support system. I'm not saying that you can't do it alone. You need some support system. I've got a support system, an emotional support system. So that support system has worked for me. During the day, sometimes I don't feel well. In the afternoon, sometimes. At night, sometimes. But I have that support system and faith that even after decades, I'm going to get well. I'm going to control my because I've been able to change and control it at the right level. See the doctor, do this and that. But also know, I've got to know that if I don't do this and this, there is punishment at the end of the day. In epilepsy, you don't wait for another day. You get punished there. So a parent know that if you don't give your kids the right medication, the right food, the diet, you don't follow the doctor's advice, kichapo, the beating is just there. The beating is there. You will know at night. You know in the morning or during the day. Even after 2 days, you will know. It's not far. The patient will tell, the body will say, it's the most taxing condition you can have if you don't follow the right steps. The most other thing that you have is love, hope, and having a positive attitude towards life. To feel special. You have to feel special. You have to feel like to be a special person to survive this thing. You have to be a special person. You have to feel good. You have to be proud of yourself. You have to have pride when you're walking, when you're doing your stuff. You shouldn't let things take you down. Because if you're not confident about yourself, you're not confident about life, knowing that you're in a condition, you want to pretend you don't have a condition, and you have it, the first step is to accept I have a condition. Yes, I have a condition. Yes, I have a condition. I will take drugs. Whatever happens, happens. I will do what I want to do in the right way. But I'm confident. Confidence is everything. It will take you to the next level. It will make you go and do your job. It will make you redesign your stuff, your lifestyle, everything. When you're sad, it will make you happy, smile. And also be able to know that you should smile also. Talk to people. Smile. Share your love. Share your life also. It makes you a greater person tomorrow. That is a combination of everything. If you're mature, if you don't do that, in any condition, you get depressed. So as a parent or a guardian, I tell you, if your kid has epilepsy, and you know this thing can be controlled, it's not that it can be controlled that you don't have it, the kid, they don't have regularly, or it gets, the attacks are taken care of. My friend, follow the doctor's advice. Don't leave the medication. Don't become the doctor yourself. Just know everything is going to be okay. I find sometimes people leaving their kids alone, but father is leaving the wife. The mother is not taking care of the kids, and they can go. There are institutions. You can get help. For example, you don't have money. There's Kawe in Kenya. You don't have money, you go to Kawe. It's cheap. But no, managing epilepsy is expensive. So follow the right steps when the condition has started. For example, when you start having it at an early age, take the right steps as a parent. You know that your kid has, let's say, is class 2, class 3, it started happening. Just follow the right steps. You know you have it. Show love. Show understanding. Confidence. Dieting. The right drugs. Then the kid is going to adjust in the proper manner. Tell him he's special. Show him how special he is. Tell them, sometimes some parents don't understand the situation. That if you do not take the right steps at a certain age, they are going to suffer the conditions of having a patient who has epilepsy